Welcome to Original Medicare Part B, presented by OneSource Financial Advisors. In this short video, you'll learn the basics of what Medicare Part B covers and the potential costs associated with it, such as monthly premiums, copays, deductibles, and potential penalties for not properly enrolling in Part B. So let's begin. First of all, it's important to know Medicare Part B is optional. If you're already receiving Social Security or Railroad retirement benefits for either retirement or disability, you'll be signed up automatically when you turn 65 or in month 25 after receiving disability payments. So you'll need to manually disenroll if you don't want Part B. If you're not already receiving Social Security or Railroad retirement benefits, you'll need to enroll in Medicare during your initial enrollment period when you turn 65, choosing whether you want Parts A and B, just Part A, or no coverage at all. Please understand, however, that although Part B is optional, there could be a 10% penalty for each full 12-month period you could have had Part B but didn't if you decide to enroll in Part B at a future date. For more information about enrollment periods, creditable coverage, and potential penalties for Medicare Parts A, B, and D, you may want to watch our Medicare How to Enroll and Disenroll video. For individuals who enroll in Part B coverage, the base premium is $134 per month, which can be deducted directly from the recipient's Social Security or Railroad retirement benefits. Otherwise, the recipient will receive a monthly bill payable electronically or with a paper check. For individuals who are blessed with above-average retirement income, however, Medicare may assess a surcharge known as the Income-Related Monthly Adjustment Amount in addition to the base premium. For individuals with income up to $85,000, the base premium of $134 applies. For individuals with more than $85,000 of income, the premium can be adjusted upward to $428.60 per month for individuals with income in excess of $160,000. To calculate the surcharge for joint income tax filers, simply double the income ranges. Once coverage is in place, Medicare Part B helps pay for medically necessary doctor services, whether it's your primary care physician, a specialist, surgeon, or anesthesiologist, while also covering outpatient care like emergency room visits, x-rays, lab tests, and physical therapy, along with some home health care services, durable medical equipment, mental health services, and other medical services like ambulance rides. It also helps pay for many preventive care services. To properly distinguish between services covered by Part A, inpatient care, and Part B, outpatient care, it's important to know that staying overnight in a hospital doesn't always mean you're an inpatient. You only become an inpatient when a hospital formally admits you as an inpatient and a doctor orders it. That could be a very costly distinction as you weigh the potential cost exposure. Just like Part A, Part B also has deductibles and copays. For 2018, the annual deductible for Part B is $183, meaning that the first $183 is paid by the recipient. Once the deductible is met, Medicare pays 80% of the Medicare approved amount for covered expenses, which is a very important distinction. If an expense is submitted to Medicare that exceeds the Medicare approved amount, the insured may be responsible for 20% of the Medicare approved amount plus any charges exceeding the approved amount. If you've ever had the misfortune of being treated in an emergency room, you know how quickly those charges can add up. Add the potential of direct exposure to the excess charges, and the potential threat medical expenses pose to an otherwise successful retirement plan starts to become pretty clear. Now I know that's a lot of information, but it's important to know how your Medicare coverage works, and your potential exposure in Medicare's cost-sharing arrangement with the American people. To explore what Part C covers, along with its limitations and potential copays and deductibles, please click the link for our Medicare Advantage video. You may also want to view our videos regarding prescription drug plans, Medicare supplements, how to enroll and disenroll, and the biggest mistakes to avoid. Thank you for watching. If you have any specific questions concerning Medicare, Social Security, or anything else related to successful retirement, please call OneSource Financial Advisors at 520-686-7783 or email us at admin@finance.onesource.cloud.